Stephanie Johnson, and I'm at the first ever Breastfeeding Summit in Atlanta, Georgia, reclaiming an African American tradition. Rose is at the forefront of a movement to encourage African American mothers to embrace breastfeeding as a cultural and social norm.
It's important for the health of mothers and babies, and we know that African American women breastfeed less, and because of that our babies do suffer more of many ailments that could possibly be prevented if moms would breastfeed their babies. And also moms have significant health benefits when they choose to breastfeed their babies.
ROSE is an acronym for Reaching Our Sisters Everywhere. The aim of the ROSE Summit is to find ways to improve access to breastfeeding in the African American community, reclaim our breastfeeding experience, and to work to reform healthcare through breastfeeding. The gathering brought together a dream team of medical professionals and breastfeeding advocates, including former U.S. Surgeon General Dr. David Satcher.
It's important first that every child has the opportunity for a healthy start in life. And we know that breastfeeding is such an important part of that. We know that breastfeeding reduces infections in children. We know that it reduces childhood obesity. It reduces sudden infant death syndrome risk. And it also benefits the mother. It hastens cessation of bleeding of the uterus. And over time, it actually decreases the risk of breast cancer and uterine cancer in women. But by 2010, the 75% of all women in this country were breastfeeding, and 58% of African American women were breastfeeding. And by 6 months, only about 28% are still breastfeeding. We have a major problem.
Breastfeeding is a disparity amongst Black African American women and many minorities. Therefore, this is quite a wonderful partnership, and we look forward to future endeavors with ROSE.
Actually, for the first time, after very many attempts, we have major healthcare reform legislation, and it has been upheld by the Supreme Court for the first time.
Dr. Satcher says the Affordable Care Act provides incentives for preventative services and also provides support for community programs that promote breastfeeding.
Breastfeeding is the first food, it's the first immunization, it's the best thing next to mother's love that a mother can give her baby. This was our tradition to breastfeed for many years. And when the wars came along, women went to work, more women in the workforce, and formulas came in as a supplement, and then they took over.
We spend $850 million per year in WIC to buy formula for families who could be breastfeeding. That's $475 per non-breastfed infant in the first year.
WIC, Women, Infants, and Children's Program, initially was not really on the breastfeeding bandwagon, and a lot of women got free formula without that education. I think WIC has really changed that. They are a big force in promoting breastfeeding, and I think we have work to do in that regard.
The American Academy of Pediatrics recommends that women breastfeed for at least 12 months or as long as mutually desired by the mother and baby. So as long as the mother is still interested in continuing to breastfeed and the baby still wants to breastfeed, they recommend that it ought to continue. There's not really an upper limit of what is too long to breastfeed. The World Health Organization, on the other hand, recommends 2 years or as long as mutually desired. There's a recommendation also for exclusive breastfeeding for 6 months, but no one really says that we ought to be stopping breastfeeding at 6 months. It ought to continue considerably longer than that. Globally, the average duration is about 1.5 years, and there are many women who breastfeed for longer than 3 or 4 years.
Breastfeeding is a very important topic to us because the infants who are born prematurely really need the nourishment that they get from the mother's milk. The artificial substitutes made from cow's milk does not really provide the protection that these babies need in their first few months of life. And it also increases their risk of a third infection called necrotizing enterocolitis if they don't get mother's milk. So for our babies, it can be a matter of life and death.
So Table for Two is a community organization that seeks to establish public lactation rooms for breastfeeding moms. So what'd you eat in the bathroom? We went to undergrad at Clark Atlanta University, just right around the corner. And we took over a bathroom at Clark. We said, hey, we'll feed you guys if we can put you in a bathroom and take photos. And now they are ambassadors for breastfeeding. How about that?
One of the hot topics was the establishment of baby-friendly hospitals in the U.S.
A baby-friendly hospital is a World Health Organization designation. It tells you that that hospital is following very specific, rigorous evidence-based practices that promote the best nutrition for babies and the best mother-baby bonding.
We got it in March of this year, so we were one of the more recent, thank you very much, pretty proud of that. More recently certified baby-friendly hospitals, and as I'm told, one of the first to be certified under the new 4D pathway, which you've heard a lot about today.
Northside Hospital is located right here in Atlanta, Georgia. We are the #1 delivering hospital in the United States. We deliver approximately 18,000 babies per year. We are not a designated baby-friendly hospital by term, but we advocate for breastfeeding.
There are no baby-friendly hospitals in the state of Georgia, but we are actually working with a number of hospitals in the state and outside of the state to sort of shadow their programs.
The Rose Summit featured representatives from several breastfeeding support groups who talked about the importance of including fathers, grandparents, children, and extended family members as a part of their outreach.
One thing about being culturally sensitive is that you have to actually be where they are to be, understanding of them. It's more than just kind of sitting in the office. It's actually going out and reaching out.
So I encourage you, be the kindling in your community, in your churches, and say, listen, let's go back to our roots. Go back to the old landmark when we did not have in the formula. Everybody didn't have formula. Okay? Go back and understand there's nothing to be ashamed about. The God-given instrument of feeding our babies. And y'all have a great day. Go, Daddy, go, Daddy, go.
The mom that's delivering the newborn, she's the quarterback, she's the head coach.
We gather men who are going to be new dads or expecting fathers together, and we answer any questions that they may have.
You got to get in where you fit in, nurture the nurturer.
I am expecting October 31st, and this is actually number 5 for my husband and I. And I have breastfed all of the other 4. And of course, I'll be breastfeeding this one as well.
But there still remains the overwhelming amount of information that many Black women are just not breastfeeding. Our numbers are continuously to fall at the bottom of the scale. Now, there have been many theories behind this, and some of this dates back to the days of slavery. You can read countless journals now tell you they don't understand that racism plays a part in breastfeeding disparities, which allow unfair access to education.
I met with a few young women at my house a few weeks ago. Had met these young women over the years, at different times, but I just want you to see this 2-minute video.
Everything you do, you gotta do it for love. You would do anything for your daughter or your son.
I'm not really sure why more African American women don't breastfeed. It's certainly the best thing for your baby, and it's 100% free. Maybe it's education, maybe there's a stigma there. Maybe a lot of African American women believe that breastfeeding is for mothers back in the day, and now people just use formula.
I've heard that people don't like for you to do it in public. Some people don't think that it's healthier than formula. I'm still kind of nervous about it because most mothers who breastfed, they tell me that they have had a hard time doing it. So I'm just worried about that. But I think it'll be a good experience.
So I think once they get educated enough on breastfeeding that they'll be more susceptible to actually doing it. It's just, basically about getting educated on doing it and why is it important to do it versus using, Similac and stuff like that.
Breastfeed that baby if you want her to be real healthy.
A lot of the teen mothers, they're not really educated as to how and what and where, and have the support of their family to cater to their decision.
People would say because he's a little taller than other kids, and he had teeth, from the time I can probably remember. So they would say the same things like, you breastfeed him and he has all of those teeth, he doesn't bite you.
So you get the stereotypical stuff, you shouldn't be breastfeeding that long, or ew, that's nasty. And I'm like, why is it nasty, what makes this nasty? I'm nurturing my child.
Like not feeding as often as she should have. Then she told me how her breast would get sore and she have engorged nipples and how it would hurt and it's painful.
If they had more access to informational meetings or workshops that gave them information in the community about breastfeeding, and plus they don't see it a lot.
I think African American women need the chance to meet and talk one-on-one with other African American mothers who breastfeed and really get the facts and decide for themselves if that's something that they would be willing to do.
Breast milk and life is free. Breast milk and life is free. Breast milk and life is free. Breast milk and life. Breast milk and life.
This is 2 days before Ebony had her baby. This is Mother's Day. This was our gift. Her nursing for the first time, about 45 minutes. We couldn't wait for her to crawl up. The 3-year-old, this is her first experience. And first thing she said is, "Mommy, why is she eating your boob?" We all need to just become more comfortable with nursing. This is the president of Venezuela. Talking to a young woman who's nursing. We can't go to a restaurant and cover up and be comfortable nursing our babies without someone saying something to us. I try to tell the young ladies I work with all the time, when I try to talk to them about breastfeeding and they say, "Well, I'm gonna try." I'm like, nah, I don't want to hear that. This is what I want you to say. This is gonna be the new mantra. Yes, I can, I will, and watch me. I'm gonna do this. Thank you.
It was difficult to breastfeed in public at first, and I have had some issues with it. I have been asked to leave places or asked to cover up or asked to go in the bathroom. You know, I just decided that it wasn't worth it. So I just got over my fear. I also spent some time in East Africa, which kind of exposed me to women just breastfeeding in public very naturally.
It's important because we have to feed our babies. When you come from a poor country and a poor environment or a developing country, it means that you have to do it for your baby. It's not an option. Reaching our sisters everywhere.
There are two types of women that I've come in touch with. One is the type of woman who doesn't understand the importance of breastfeeding, so a conference like this helps. But the second type is a woman who actually wants to breastfeed, but hasn't been supported by the providers. So I think that a conference like this, to reach providers as well as mothers, I think is very important.
I live in Tennessee now, and childhood obesity is very high in Tennessee. It's one of the highest states in the U.S. The same Tennessee also records the lowest rates for breastfeeding. So I told them in my university, I said, look, I'm relevant. You have a problem here. You have obesity. Nobody's breastfeeding. I'll help you. So that's how I got my little project.
It's all about skill building. And breastfeeding is a skill. When we started our centering program, our baseline county WIC breastfeeding rate was 39%, and our breastfeeding rate, actually the last time I looked at this number, was 73%.
I'm a big supporter for breastfeeding, and I love it, and I want every woman to do it. But these are all of the different avenues that give support for a woman and all of the different things that she could come up against. And it's things that I've never even thought about before.
As someone who works in an area where there aren't a lot of African Americans in general, the ones that I do meet in the WIC offices, I really, want to target them and help them see that it's not taboo in our culture or in our community, that it's something that's beautiful and we want to embrace it. And so that's really my mission.
We have many organizations networking together, and a lot of these organizations didn't even know each other existed. This is why social media and using online resources to network with each other is so essential. You need to find out who's out there, you need to collaborate, and you need to make small events bigger. Using social media, using hashtags, searching on Twitter, searching on Facebook, Google+, can really help you bridge this gap as we try to get more African American women to breastfeed throughout the U.S.
So I made this little collage in breastfeeding, and so just looking at in ancient times, you have Aset and Horus here, he's in her lap suckling, you have the Black Madonnas, and then we went through this enslavement process, and you have the wet nurses, the mammy image, and for me, I'm reclaiming this.
When
We have folks coming over here from other countries, they start taking on our culture, and the breastfeeding rates start dropping in their culture, and we were beginning to see this in the Latino population.
Sometimes moms just don't want to do it, and I hear it all the time in my clinic. Well, I can't do it because I've got to go back to work and school, or every Friday I have to get my hair done, and no one wants to keep the baby because he always wants to be on the breast. And when they see a peer counselor and we're working and we're going to school and we're looking like they are and we're going through everything they're going through and we're still able to breastfeed, and they'll ask you, how did you do it? And we'll tell them. They want to know who else is breastfeeding, especially my dads when they come in class. Did you know that Michael Jordan was breastfed for 3 years? And they're like, oh. Well, maybe it's okay.
I had a mom actually a week ago that I helped. She's 39 and this is her third child. Her oldest is in the military, 19 years old, so it was like starting all over for her. But she had flat nipples and didn't think that she could do it, and I did a home visit. She got the baby latched on and she was so happy.
I usually breastfeed for about 2 years for the older 3 I did, and I hope to do that for her. And the weight comes off pretty quickly. I think breastfeeding on demand especially, and just relaxation in terms of I can really feel especially when I'm stressed out about other things, in the process of nursing, I feel, at least for me personally, I feel like a little bit of a relief.
We are very excited that there is a new federal nursing breaks law. This was passed as part of healthcare reform, the Affordable Care Act in 2010. It is still going through the implementation stage. The law requires that all employers provide reasonable break time and a space that is not a bathroom for mothers to express milk. And it also has a special focus on hourly workers, convenience stores, restaurants, retail.
As a working mom, it was a little challenging. I actually had my own office at the time, so I was able to pump at work. A lot of the women that I knew didn't have the same privilege I had, so it was very difficult for them, and especially when they're working, like some of them in the restaurant business, they couldn't pump. They would have to pump in their cars or pump in the bathroom or don't pump at all.
My name is Jerry McKinley, and I'm the facilitator for the work groups, the action planning that we're doing here today. And we are reclaiming an African American tradition, which is breastfeeding.
Surely not after they show up at the office. They screen them.
They're getting to know each other, talking about some of their concerns. Individual groups that will then act on a particular issue.
Our money, time, expertise, experience.
My name is Deanna Drihe. I'm the program officer at WK Kellogg Foundation. We're a national and international foundation. And we are happy to be here with Rose, Reaching Our Sisters Everywhere, and excited about the progress of putting women together and working on this movement to support African American women across the nation.
I really am thinking about becoming an OBGYN, and I feel like this conference is really important because I do want my patients to breastfeed their babies, because I know the importance that I've learned from just attending this conference, the benefits for the baby, the benefits for the mother.
After the brainstorming sessions, the groups agreed to support one main goal: to launch a membership drive.
Our goal was to recruit 300 members by 6 months.
They also agreed on a membership statement defining Rose's desire to become the go-to organization on breastfeeding issues affecting women of color in North America.
We are endeavoring to establish a national organization whose title and goal is reaching our sisters everywhere with culturally specific information regarding breastfeeding in our communities.
I'm just hoping that everyone will be impacted. This is a movement that needs to happen.
Participants in this conference will use their knowledge to help provide culturally competent encouragement and support so that a higher number of African American mothers will choose to breastfeed their babies.
Rose, reaching our sisters everywhere. We feel that we can make a major difference. It's about images and being positive, and one of the main things we like to say is, instead of hearing people say, well, I'll try, that yes, I can, I will, watch me do it.